When a dog stops to sniff the grass, they are interacting with an invisible biological record. If an infected animal urinated here months ago, microscopic viral particles may still be clinging to this blade, waiting to be inhaled. This is Canine Adenovirus Type 1, or CAV1. It is a DNA virus that lacks an outer envelope, making it extremely resistant to freezing, heat, and many common chemical disinfectants. Exposure can happen long after an infected dog has left the area. Recovered animals often shed the active virus in their urine for 6 to 9 months. Despite its environmental resilience and the long period of shedding, this highly contagious virus is rarely seen in the general canine population today. This research article on canine hepatitis in Kerala, India, illustrates the virus's current rarity. Out of 40 clinical cases reviewed, researchers found only one single case caused by CAV1. That is a frequency of just 2.5%. However, for a 3-month-old unvaccinated puppy, these statistics are irrelevant. When the virus finds an unprotected host, the clinical reality is devastating. The puppy's condition worsens within days. It suffers from a high fever, deep lethargy, and an enlarged, painful liver. In the absence of a vaccine, CAV1 is a rapid and lethal pathogen. The infection begins when the virus enters the nose or mouth, immediately replicating in the tonsils before moving deeper. This leads to viremia. The virus overwhelms the regional lymph nodes and enters the bloodstream, where it is carried to every major organ system. CAV1 has a specific tropism, meaning it has evolved to target and invade 2 very specific types of cells in the host. The first targets are hepatocytes. As the virus replicates, the liver cells die, causing jaundice and organ dysfunction. The second targets are endothelial cells lining the blood vessels. The destruction of this lining causes internal bleeding and fluid accumulation. CAV1 destroys the body's primary systems for blood containment and waste filtration. As the virus spreads, the dog's immune system begins producing antibodies to fight the infection. These antibodies quickly attach to the viral particles circulating in the blood, forming large, heavy clumps called immune complexes. These complexes are too large to pass through the body's smallest filtering networks. They become physically trapped in the kidneys and the vessels of the eye. This blockage causes severe inflammation. In the eye, the normally clear cornea becomes cloudy and opaque, taking on a blue-tinted appearance. This signature blue eye is not a direct effect of the virus, but a result of the dog's immune response trying to clear the infection. In the middle of the 20th century, scientists developed a vaccine using a live, weakened strain of the CAV1 virus. While it prevented fatal infections, the weakened virus still triggered the formation of immune complexes in some dogs. This meant that while the vaccine saved dogs from liver failure, a small percentage still suffered from permanent kidney damage and the cloudy blue eye condition. For years, protecting a dog from hepatitis meant accepting a risk of these permanent side effects. Researchers began using a different viral strain, Canine Adenovirus Type 2, or CAV2. This virus causes mild respiratory illness similar to kennel cough, but does not damage the liver. This relies on a mechanism called cross-immunity. Because CAV1 and CAV2 share similar surface structures, an immune system trained to recognize the mild respiratory virus will also neutralize the deadly liver virus. Switching over to the CAV2 vaccine completely neutralized the hepatitis threat without the risk of corneal inflammation or kidney damage. This viral substitution is the reason the H in the standard DHPP combination vaccine is highly effective and safe for puppies today.